Good morning. Online learning has been on the rise for the past couple of years. It is one of the most important trends in higher education. Fully integrated online schools and traditional university offerings of online degree programs continue to rise every year, and the number of students that participate in this style of learning environment is also high. To keep up with this trend of online environment, the following information will show you several different online platforms used alone or in combination. So, text is still a logical choice to convert your lecture materials. You can use text in the form of web pages, PDFs, or other documents, or as a blog format. The advantage to using texts are that your students can copy the material and add their own notes, and they will have time to reflect on what you said. The main disadvantage to this format is trying to transcribe your speech into something readable and not just listened to. For anybody that's ever done text to on your phone when you're using your speech, it never comes out right and you send it without proofreading. This is similar to that. Next are PowerPoint slides. This limits your face-to-face ability with your students unless you add a cameo or video recording. A PowerPoint presentation must carry the entire presentation. Creating captivating design, images, and graphics are important to keeping your students engaged and listening. Narrated slides, audio, or videotaping and screencasting is another platform style. When you narrate slides is a good way of taking students through a series of steps. Just avoid narrating your bulleted items in the slide. If you decide that you prefer to use audio or videotaping, you will need to take into account any disabilities and learning preferences your students may have. You can create captions or prepare a transcript of your instruction. We will discuss more on screencasting later, but these lessons can be created on your computer. Now, I would like to move on to two types of discussions that are normally held in the classroom. The first one is an asynchronous discussion, and this is the use of online interactions where your students do not need to be present simultaneously to participate. They can use a discussion tool like a forum or online messaging platform. The next is asynchronous discussion, which can be a text-based chat activity, or it can include audio or video. But whatever activity you choose to assign, the student must be present at the same time in order to participate. Now, the group-oriented work and student presentations, and there are many types of group activities. They range from peer review to true cooperative learning exercises. These can be done in an online environment. They must be well organized and done at a proper pace. If you're going to require student presentations, you need to be sure you have decided what role they will contribute to which assignments, activities, or topics, and will they be presented by a group or a sole student. Research activities, and there are many types of research activities that you can assign. Web-based, when the research is obviously web-based. Social bookmarking is another, and this activity thrives on open sharing depending on the social bookmarking tool used, like Diigo or Evernote. Another type of research is library research, and this can be done online if the facilities, materials, and services are available in their local school or community. And some schools like Wayland give their students the ability to access electronic full-text services on their website or in their student services. And the last type of research opportunity is fieldwork, internship, or other experiential learning. Again, Wayland is a great school that will use experiential learning as credit hours with the proper paperwork. They consider on-the-job training a great resource for learning. Going out in the field implies experimentation or apprenticeship, on-the-job training, as are internships. Another tool to use for online learning is the assessment considerations. These are very important to the planning of your lessons. Of course, any type of assignment can be potential assessment, either formative, which is a part of an instruction sequence, or summative, which is a graded assignment or test. Types of testing available for you to use can be high stakes or low stakes testing. High stakes testing requires a password to access the test. The test can only be opened during a certain time frame that you choose for your student, and the test may be timed. A low stakes test is the traditional multiple choice tests, and these do not have the greatest reputation as being the most effective teaching technique, so use these types of testing with care. Now, some of the last things to consider when designing your course is to encourage academic integrity among your students. Don't assume that they're going to cheat. Don't tell them they're going to cheat. Just emphasize the concept of academic integrity. Even though your course may be online, You may choose to use textbooks, course packs, and software, either hardback or softbound for your students, and that might be a viable option for you or for them. And finally, redesign. You will find from year to year, or even less, that you may need to meet new course specifications. And this may be due to new guidelines set out by your school or a change in the textbook that you're using. And be aware of these changes and redesigning your course work to fit into the new guidelines. Okay, now let's move on to a new subject that can help you with your video presentations. What is a pitch deck? Well, it's a presentation that you can use quickly to convey the key aspects of a concept to your students. And here are the 10 best presentation tips and tricks. So number 1, when using photos, be sure that you're choosing photos or images that support your narrative, and they should support your presentation, not detract from it. Number 2, when you're choosing colors, make sure you choose the right contrast and the amount of white space that is appropriate. Colors communicate a lot of information, and choose one that are harmonious and relevant to your subject. Be sure you're not packing too much information on one slide. You want to keep your slides simple and easy to read. Number 3, animations are very distracting. They're fun to try, but can get in the way of what you are trying to get across to your students. So if you want to use animations, use them to highlight an important point. Number 4, plan your content beforehand before you start planning your presentation. This will help you finish faster and your work will be more organized. On the same hand, choose your font carefully. They need to be legible and visually appropriate to your students. Number 5, be entertaining. Nobody likes to sit through a very dull and boring presentation. Don't just state facts, connect with your audience. Number 6, you will be likely to lose your audience if you go beyond 20 minutes. Humans have an attention span that is less than 20 minutes, but if you keep it entertaining and engaging, you're more likely to keep their attention the full 20 minutes. Number 7, the rule of 3 is a principle that suggests if you present your information in groups of 3, it becomes more memorable and impactful. Number 8, can you describe your presentation in one sentence? Keeping this in mind, when you create your presentation will help your students understand the idea you are trying to get across. Keep your content on target. Number 9, engage your audience. Tell engaging stories. You might start with a question or problem, walk them through it, and then end with a solution. And last, end with something exciting or memorable, and this will create a memory of the presentation and a willingness to talk about it. So what does a brain look like that has suffered significant trauma? Either physical, as if getting hit and suffering a traumatic brain injury, or trauma as related to living through such physical, mental, and sexual abuse that your brain creates alternate personalities, or you can't control your anger, anxiety, or emotions. Do these types of brains look similar? How do they look different? And can they be healed? Well, this is a subject that is near and dear to my heart, called brain SPECT imaging. It is something that I have researched over the years and would love to teach a class on. My husband and I adopted our granddaughter when she was 11, and she is now 14 years old. And when you interact with her, you would not notice anything other than a normal 14-year-old teenage girl. But she has experienced more trauma in her short life than most people have even read about. And in trying to help and support her trauma-related mental health issues, I came upon brain SPECT imaging. So Dr. Daniel Amen founded the Amen Clinics, and his work revolves around the concept that brain health is central to overall well-being, believing that when the brain functions optimally, so does a person's life. And his mission is to revolutionize brain health and end mental illness by providing education, products, and services to improve brain function. He became a pioneer in using brain SPECT imaging to visualize brain activity and diagnose psychiatric conditions, building the world's largest database of brain scans related to emotional, learning, and behavioral problems. But what is brain SPECT imaging? Well, SPECT stands for single photon emission computed tomography, and it's a 3D image of the blood flow in the brain, and it can diagnose and help form a treatment plan for the brain disorders, including brain injuries and tumors, dementia and stroke, and other trauma-related mental disorders. Now, my granddaughter has severe PTSD, ADHD, and possibly dissociative identity disorder. When researching how to help her, this is what I came across. Now, what are the significance and implications of brain SPECT imaging? Well, brain SPECT imaging allows physicians to look inside the brain to observe 3 things that are significant to current and future research. diagnosis, and treatments. It looks at the areas of the brain that work well. It looks at the areas of the brain that work too hard, and it looks at the areas of the brain that do not work hard enough. In the images below, they show cerebral perfusion, and cerebral perfusion refers to the amount of blood delivered to the neural tissue. Now, the photo on the left shows a healthy 3D surface rendering looking at the top 45% of the brain perfusion, and this one shows full, even symmetrical perfusions. Then the photo on the right is looking at the areas of increased perfusion, and you see the blue that equals average perfusion, while the red equals the top 15% of perfusion, and the white is the top 8%. And this scan showed increased perfusion in the cerebellum. Now, in the images below, the scan on the left shows toxic surface scan with Swiss cheese shriveled appearance, indicating areas of decreased perfusion. And this is seen in someone with mixed personality disorder with narcissistic and antisocial features. Now, the scan on the right shows trauma, asymmetrical decreased perfusion, left frontal temporal lobe. This is seen in someone with severe impulsivity and depression, and it showed evidence of substantial hyperperfusions indicative of trauma in the frontal temporal lobe region. And hyperperfusion is a term that describes a reduced amount of blood flow. Now let me give you an example from the scan below. Mr. C suffered from crippling anxiety, extreme mood swings, recurring panic attacks, negative thinking patterns, anger issues, and difficulty sleeping. And these issues negatively impacted his relationships, both at work and in his social life. He was shy and reported always being in a bad mood. In his family, there was a history of addictions and depression. Mr. C first saw a psychiatrist when he was a teenager and was diagnosed with multiple disorders, including bipolar disorder, ADHD, and intermittent explosive disorder, or IED. Now, Mr. C's scans below on the left is before treatment, and on the right is after treatment. Mr. C's SPECT image before treatment on the left reveals low activity, especially in the prefrontal cortex and temporal lobes, compared to the post-treatment image on the right, showing overall improvement. Now, after Dr. Daniel Amen reviewed his scans and learned more about his history, it was clear Mr. C was struggling with the lingering impacts from multiple head injuries, as well as the exposure of toxic gasoline fumes, and had previously been given psychiatric labels based on symptom clusters. His psychiatric medications were stopped, and he was given brain supportive supplements and placed on a program of to rehabilitate his brain with diet, exercise, and hyperbaric oxygen therapy, shown to help with traumatic brain injury. Now, Mr. C came to see his problem as a brain health issue rather than as a mental health issue, which shifted his mindset to being a more active participant in his own care. In just a few months, he lost 80 pounds, his mood was better, anxiety was decreased, and he had better control over his temper. And several months later, his brain also showed significant improvements on the follow-up SPECT scan. So, what did the studies and the research conclude about SPECT brain imaging? Well, research showed SPECT as an underutilized tool that should be used more in the mental health fields to add to the diagnosis and treatment for the patient. Evidence showed that SPECT is a well-established and reliable measure of brain function and is helpful in understanding and targeting treatment for individual mental health patients. Research showed that by identifying the areas of the brain that have increased or decreased brain activity, SPECT can help a clinician differentiate between different mental health conditions. SPECT imaging individual study cases showed there was an improvement that allows for more targeted treatment plans and has the potential to improve diagnosis accuracy. Now, research into SPECT imaging showed that it provided a visual representation of brain activity, including dissociative identity disorder, which is what is important to me when I was doing this research. Now, other conclusions that research showed was that the brain SPECT imaging showed blood flow patterns in the brain and highlighted areas that might be more active during DID episodes. SPECT imaging indicated which brain networks engaged in switching between the alters. Studies of individuals who have experienced trauma using SPECT revealed potential abnormalities in the regions of the brain that are associated with processing the trauma. And this is relevant in DID, where trauma is a significant factor. The imaging provided additional information that helps clinicians differentiate DID from other mental health conditions that have similar symptoms. And the research also showed that SPECT imaging is not a standalone diagnostic tool. It is used in combination with a clinical evaluation. Now, there are a number of important areas where SPECT has the potential to provide relevant information to help personalize treatments to patients' specific brain system pathophysiology, rather than rely solely on general diagnostic and/or therapeutic categories. Brain SPECT imaging has identified 7 types of anxiety and depression, 7 types of ADD and ADHD, and 7 types of addiction, and there are 200,000 and growing functional brain scans available through the AMEN clinics. Now, the benefit of using brain SPECT imaging is that the patients' and families' guilt, shame, and stigma are significantly reduced as they see their illness as medical rather than a moral problem with concurrent improvements in treatment compliance. Brain SPECT or any other neuroimaging modality should always occur in conjunction with clinical assessment, since it is not the isolated diagnostic accuracy that has greatest importance, but rather the value added to routine clinical assessment. Research is not over in this area, and I continue to read articles that I find new that are every day, and I still will continue, with God's help, to find answers that will help my granddaughter overcome her trauma and fix her brain. Thank you.